Hey guys, it's Dr. Becker. I'm here to talk today about what most people refer to as ringing in the ears. So, ringing in the ears is something that doctors and ENTs call tinnitus or tinnitus. Most ENTs say tinnitus, but it's kind of a tomato kind of thing. Tinnitus is extremely common. And in today's video, we're going to talk about what it is, why we get it, and what are some things that we could do about it. And so by the end, I hope you have an understanding of your situation, whatever it is, and some of your options. So first of all, what is tinnitus? Tinnitus, or ringing in the ears, is just really a broad category of any kind of perception of ear noises that don't actually exist. So technically, they're kind of like a hallucination of our auditory system. Even though when our ears make noises, it seems like there's a noise in our ears, like there's something coming from our ears. It's not actually coming from our ears. What it really is a noise that's coming from our brain. So our brain is creating a perception of a noise, and there really is no noise. So some people ask me, well, can you hear it? Or if you had a tiny microphone, could you hear it? And the answer is no. If there is an actual audible noise, we call it something else. But basically the tinnitus that most of us talk about, ringing in the ears, is something that nobody else can actually perceive. And sometimes patients tell me that they, when they first notice it, they'll ask people like, do you hear like a motor, or is there something on, like an appliance buzzing on somewhere? And they'll kind of tell me that they looked around their house looking for like something that they left on, but and then they realize they can't find it, and that's probably just in their head. And the interesting thing about these noises is they can sound like anything. So even though the colloquial expression is ringing in the ears, it turns out that most people don't actually have like a ringing at all. Probably the most common is like a beeping or an electrical noise, or like the sound of crickets or cicadas at night. But some people get like a static sound. Some people have a sound of like water rushing through a pipe. Other people will describe like tires on a road or something sizzling in a frying pan. So these are all sensations that people report hearing when they're not really there. So the question is, why does that happen? Why does our brain have a tendency to make up sound? And the answer is we're not entirely sure, but we think that it's something that our auditory system is very much primed to do. So there was an interesting study that I like to tell people about that took people who have normal hearing. So they were pre-screened, they had no ear problems, they had no history of hearing problems or anything like that, and just normal volunteers. And they put these volunteers into a soundproof booth or a little soundproof room, and they deprived them completely of any type of sound input. And these people were left in there for many hours. And there were a couple arms of the study. My favorite arm was the arm where they were told, you might hear something. We might put some sound into this room, so just pay attention. Maybe you'll hear a sound, and we'll ask you afterwards, if you did hear something, what that would be. And then they took a group, and they didn't tell them that. Okay, they did the same, putting them in the room. And then afterwards, they asked people, did you hear a sound? And it turned out some 60% of the people who were told that they might hear something in the quiet room did. And they reported all kinds of noises similar to the list that I just gave you. So it turns out that whenever our ears and brain are deprived of sound, they actually sometimes just make it up. And I sort of think that's kind of like the neurotransmitters are used to working all the time, and they sort of fill up, get ready to do their job, and they have all this message, this chemical messenger. And so when they're not using it, they just kind of like throw some out into the synapse, and then the upper brain picks it up as like some kind of noise. So I think of it that way. And the other interesting thing about the study is that the people who were told that they might hear something actually did hear something more, which shows you how suggestible tinnitus is. It's very much something that if we listen for it, it will come more, and if we ignore it, it will come less, or if we're busy thinking about something else, we won't notice it. So those are the two take-home studies from that, or take-home messages from that study. The first is that our auditory system is primed to do it in the absence of sound, and also that our thought processes very much influence whether or not it's perceived. So a lot of people also ask me, well, isn't tinnitus a sign of damage? Doesn't it mean that there's something wrong, with my ears or my brain? And the answer is sometimes. So most of the time, if people are perceiving some ringing in their ears, it does mean that they've had some kind of hearing loss. Now, remember, our hearing loss is going on from the moment we're born till the moment we die. Our hearing is getting worse. So for instance, little kids, they can hear, they have if you have normal hearing, they have a very broad spectrum of sounds that they can hear, including incredibly high pitches that we're really not able to hear anymore by the time we're, say, 18. So even a healthy 20-year-old might not be able to hear something super high pitched that a 8-year-old would. So that 20-year-old can still have a very high pitched tinnitus, basically that high pitched because the ear can't hear the sound anymore. The brain's being deprived of that sound and will fill in that space with a very high pitched noise. So that's something interesting to think about. But then as we get older, from 20 to 30 to 40 and on up, our hearing spectrum does kind of shrink, and it gets harder for us to hear those super high tones. And so in a sense, we all have a little bit of relative deprivation of sound in the high tones as we get older, because our ears just don't pick it up as much as they used to. And some of us who are prone, those high-pitched, the neurons responsible for perceiving the high-pitched sound will just make stuff up, especially in quiet, especially when we're not doing something else, especially when we're tired, especially when we're thinking about it. And actually some other situations influence tinnitus too, like if we're stressed, anxious, or depressed, then it'll come more as well. So that's really interesting, right? That tells us that there may be some ways to think about how to, sort of make tinnitus less prominent if it's something that really bothers us or that we suffer with. The first is that we can think about, restoring some of our hearing. So for folks who are older, or who just have a familial hearing loss, or who've suffered some kind of, problem with their ear, either damage or infection or something like that, and have tinnitus in the affected ear, it turns out that if you actually get a hearing aid or have surgery on the ear to fix the ear bones or fix whatever's wrong with the ear if we can, then that will actually get rid of the ringing. But most Americans, most people have it because they've had some age-related loss in the high tones. And so for them, even if they feel like, my hearing's pretty good, I don't really need a hearing aid to hear people, they sometimes will choose to get one just because the ringing is bugging them and they want to have a more quiet perception in their mind. So believe it or not, hearing aids can be very helpful in that situation. And also, of course, if there's something else wrong with your ear, even having wax in your ear, like a big wad of it stuck in there, will cause the ear to ring more. And so someone should check your ear out and see, well, what's going on with it? Like, why is it ringing? Do you have a hearing loss? Like, is there something we can do about it? Drain the fluid or clean the wax or take care of the infection, put a hearing aid on it. Any number of these things can help get rid of that perception of tinnitus. It turns out too, there's another thing that really we can focus on to try to get tinnitus less prominent, and that is, now you got to go with me on this one because this is kind of weird, is actually TMJ. So TMJ is a trash can term. It basically stands for temporomandibular joint, and TMJ is your jaw joint. So it's a joint where your jawbone hits the top of your skull. There's a little joint there. It's kind of like your knee. And it sits pretty much in your ear. So if you move your joint and you touch right there, you can feel it moving. You can even put your finger in your ear. You can feel it really deep in the ear canal moving around. So your jaw joint sits right where your eardrum is. And it turns out, if you have some issues with your jaw, like say you're a clencher or grinder, you have some pain or pressure in there, something with the muscles in the upper neck and it's pulling it weird, that will actually increase your tinnitus as well. Now that's something we don't really entirely understand why that happens. And when I was a resident and I learned about it, I was like, what? That doesn't make sense. How can your jaw make your ear ring? But I'm telling you, it does. So it's one of the things that we can address to try to make tinnitus better too. So think about, do I clench or grind my teeth? Should I really be wearing a mouth guard? Maybe I should, see the physical therapist and get this jaw tightness and neck tightness worked out. And that can sometimes actually help with the tinnitus as well. And then the last thing is that if tinnitus is really, really bugging you, like to the point of like really driving you crazy and causing anxiety and depression and really affecting your quality of life, then you should definitely, first of all, see an ENT doctor and get it checked out. Make sure that you don't have, something that's a red flag. Make sure that there's nothing, easy we can fix, like wax or fluid or something like that. We'll check your TMJ while we're there. But if it turns out just to be some age-related loss, and you can consider getting a hearing aid if that's appropriate. But it may be too that you're just stuck in a little rut in terms of getting fixated on it. And the brain really kind of needs some help, letting go of that behavior of making that noise. And so in addition to the usual advice of, trying to do some deconditioning, distraction, and putting on background noise or white noise to kind of give your brain something to listen to so it doesn't, make the sound as much. Those are really good strategies for coping with tinnitus. But if that's not working, it may even be something that you want to talk to your primary doctor about in terms of thinking about antidepressant. They can actually help your brain become a little bit less obsessed with making that noise. They can stop that obsessive loop that creates the tinnitus over and over again and can actually help break the cycle, getting people released from the constant experience of hearing noises in their ears. So that's the bottom line. Just to recap, I'm basically saying that ringing in the ears is incredibly common, that our brains kind of want to do it whenever there's some kind of change in the sound input to our brains from our ears, or any kind of inflammation around the ear, including the jaw and neck. And that it's not really true when they say that there's nothing you can do about it, because it's very important to look at what the underlying factors are for why your ears are ringing. Do you have hearing loss? Do you have fluid? Do you have wax? Do you have TMJ or neck tension? Do you have anxiety or depression? Are these things that we can work on to help you get your symptoms more under control? So in the end, I hope it's helpful to understand what it is and also what are some of the things you can do about it. And then encourage you, if you do have ringing in your ears, to get it checked out, to get it looked at, to get an audiogram, which is a hearing test, to understand what's going on with your hearing, and then talk to one of us about what are some of your options for treatment, because there really are options. So I hope it was helpful, and I'll see you guys next time. Bye.